wheelchairs that have to walk around with the what do you call it, oxygen tanks, and we don't have sidewalks in some of our neighborhoods. So how do we help people who can't help themselves? That's a big one, isn't it?
And jump in.
I mean, from a policy standpoint, I wish that I had an answer of what organizations to go to. But I think that that's one of the general concerns is that it is not always easy to get services, and I mean, to be fair, the state doesn't always want to make it easy to get services because that then costs money, and we see that very easily, even with big programs like Medicaid and Peach Care that a lot of people know about, but even more obscure, or not even obscure, but much smaller programs that are more targeted to people with specific conditions, specific disabilities, it's even harder to get services. I can't imagine that this is a path that Georgia goes down in the near future, but one of the great parts of the CHIP reauthorization is what's often referred to as IKEA. It's not a big store, but it's the Immigrant Children's Health Insurance Act, and it waives the 5-year waiting period for legal immigrant children to get coverage on Medicaid and Peach Care. The state has to proactively do this. They're not required by the federal government to cover these kids, but the state can do it, and it's. I mean, that's another part to I guess to try to get involved, and we can try to put pressure on the state. And it's very clear these are legal immigrant children, and they put in the Senate, they put in provisions to strengthen, if you will, the hoops that they have to still. I mean, they have to prove their status here legally. So it's not a backdoor. Anybody who says no, this is just going to cover undocumented, that's not true. It's going to only cover legal kids and some pregnant women, I believe, and it would apply to both Medicaid and Peach Care. And that's something that the state will. It won't take. I don't know. It may take legislation in Georgia the way our program is set up, but it may not. It may just be something the agency can do. That would be a tough fight at the legislature, but at the same time, it is. It definitely could be one worth having.
So, what we heard was that we can affect policy, and that's what we have to do. And where people thought it was a lost cause to defend and take up for and get inclusion for those who were actually documented, to not have to wait 5 years and never get sick in 5 years, right? But that policy was affected by an outcry and an influence and a strategy to say another step in coverage for all, for everyone. Not coverage for Americans now, but coverage for everyone. Affecting policy and being strategic about it is what gets us to the next step, imperfect as it may be. But Representative?
I think sidewalks and things like that, you've got your livable cities initiatives, which can be looked into, because those are dollars that come down, and I think those are federal dollars. Not every community is going to have a sidewalk on every street. I mean, bottom line is, it's not going to happen. You want them on the more major thoroughfares the cars travel on, that feed the neighborhoods that run off them. So I think that, that needs to be looked at. Lighting in neighborhoods, a lot of our neighborhoods are older, and some were built with underground lighting and such. And so that, honestly, the residents have to pick up on some of those things. FODAC is fabulous for working with the community. Friends of Disabled Adults and Children, in terms of having equipment for handicapped folks. People donate to them when they finish using equipment, and they have many things that are available to help in the community, and they do fundraisers and all of that. I mean, they're a great resource. But I also think together the people in the community and having people become better educated on the different things. In DeKalb County in particular, we have a new county commission. It's, you know, as much as I know we all work and we can't attend their county commission meetings, you can watch them on TV in the evenings when we're at home. I mean, this show again. And we can learn how our county works. And we can ask questions. And we can have town hall meetings and have different folks that are experts in the area come out and help give us guidance. And I just think those are good ways. I know you're out in the community trying to learn all that you can, and it's encouraging other people to also become educated. For anyone who doesn't know, Claxton's in a really unique situation in that their immigrant population is primarily refugees and therefore here legally. And this is a hard thing sometimes to get across to legislators, is all our immigrants are not illegal immigrants. Many of them are here legally. They are refugees for many different reasons from their native countries, and some of them did not necessarily want to leave their countries, but had to because of the situations over there. And it's making them understand this is what America is about. We open our doors to people, we help people, and we help people, we give them the resources so that they can help lift themselves up. And healthcare is one of them while they're here. And I mean, I live with that paranoia down there. I mean, oh my gosh, we're going to let someone get covered for healthcare that's, you know, an immigrant. Well, you know, you can't look at it that way. You have to look at a lot of things. And truthfully, I think we're better off whether not asking what the immigrant status is necessarily, but ensuring that we have healthy people in our communities.
And to come full circle, if you came down to the Capitol, now is a good time because a lot of people are in the hallway from the state departments and the advocacy organizations that assemble information maybe within their area of interest on services available. So if you came down and made connection with the Atlanta Alliance for Developmental Disabilities, their information on just the services available there, or Ellen Yeager with the mental health advocacy groups would say, here's what we give out to people. You could really assemble, I know that's not a real consumer-friendly thing, but you could assemble by making those connections and wind up with a great list of resources. And just the politics of it all, having been through some of the anti-immigrant stuff last year that was really nasty.
It's ugly.
Yeah, but legislators do see the asylee and refugee community on a little higher level than the other groups. That's one of the problems of the politics of it down there. But anyway, there would be a good opportunity, I think, for you to open some doors to having that information flow back.
Can I add to that? You know, when we've seen this backlash against immigrant populations, those at the heart of that have often said, "Oh, it's not legal immigrants. That we don't have any problem with legal immigration. It's this undocumented thing that we've got." And they like to say that they totally separate that. And things like this immigrant children's health coverage are a good opportunity for advocates to say, okay, put your money where your mouth is. And if you really think that is your only problem with the undocumented issue, and you know, legal immigrants have your full support, then why don't we do this? I mean, there's, you know, this is very obvious, but there was certainly never any rational reason for the 5-year waiting period. It was there. It's just an arbitrary thing that was thrown out there at one point. So
I might add one point, and that is that the idea that we can, that as a society and as a country, if we peel off the people we don't want to provide care to, that doesn't undermine our country as a whole is just economically it doesn't make any sense, because we end up paying for their care anyway. We end up paying for them when they go to the emergency room. When I was in Ohio, I heard a city, Shaker Heights,